as we've seen recently in Guyana, we've had increasing temperatures. And with this comes, or we expect that there should be an increase in heat-related illnesses. Now, these heat-related illnesses are basically a group of disorders that usually occur due to overexposure of heat and the body's inability to regulate the body's temperature due to this. Ranging from the most mild case to the most severe case, one can present with something known as a heat rash, or what we commonly call heats, to heat stroke, which is known as a medical emergency. Among the populations that suffer more from heat-related illnesses, we consider the pediatric population to be about 50% of that. And among this pediatric population, we can find that most heat-related illnesses will occur within the exercising adolescents, and also among children that are left alone or unattended in vehicles or in environments with excessive heat. Some common signs and symptoms that caretakers or even teachers or parents can look out for with these heat-related illnesses may include something from as mild as the child complaining of increased thirst, headaches, they may complain of dizziness or feeling faint. One of the most important things that you need to take into consideration is where we live and how you dress the child. So one of the things that you can do is to just ensure that they're appropriately dressed in loose fitted clothing that's going to allow them to not become overheated during the course of the day. You can also ensure that there's an increase in their fluid intake. If you're someone that pays attention to the weather forecast, you can take heed and you will know what type of day we'll have. And you can also limit the amount of time the child is exposed to the heat outside. For example, if you know that your child is out for more than 20 to 30 minutes, you should probably call them in. Let them come in, take a break, hydrate, spend some time in the cool before they go out back again. Being exposed directly by the sun isn't the only thing that we should be worried about, because if we're also in very humid environment, we can also suffer from these, something like heat exhaustion. And I think that it's important that being in that environment, you need to ensure that it's properly ventilated. One of the other things that I think is very important, or what the teachers can also do, is take periodic breaks as well to ensure that the children can have a 10-15 minutes to hydrate as well.